आज हम मेजर कॉमन सर्जरीज जो हम परफॉर्म करते हैं उसके बारे में डिस्कशन करेंगे। ये वेबिनार है, इसमें हम लोग कोशिश करेंगे जितना मैक्सिमम मैं आपके साथ नॉलेज शेयर कर सकूं, क्योंकि सर्जरी इज़ अ वेरी वास्ट सब्जेक्ट और इसके अंदर बहुत चीज़ें हैं। लेकिन आप लोगों को मैं बेसिक्स करूंगा। आई होप के माय ऑडियंस इज बेसिकली डीवीएम स्टूडेंट्स और डिफरेंट सेमेस्टर्स के हैं, कुछ फाइनल ईयर के हैं, कुछ लोग डीवीएम कर चुके हैं। आपने ये सब चीज़ें पढ़ी हैं, या जो जूनियर स्टूडेंट्स हैं वो ये सब चीज़ें डिटेल से पढ़ेंगे इन द टाइम टू कम इन द फ्यू सेमेस्टर्स। तो ये आपको थोड़ा सा नो हाउ हो जाएगा कि हाउ वी परफॉर्म सर्जरीज, और सर्जरी होती क्या है, उसकी बेसिक्स क्या हैं, और हाउ वी प्रोसीड। और आपको मेजर और माइनर सर्जरीज करने के लिए यू शुड बी हैव द बेसिक नॉलेज और स्किल। और प्रैक्टिस तो आपने खुद करनी है, क्योंकि लर्निंग में सबसे पहले चीज होती है कि आपको उस चीज के बारे में पता हो कि व्हाट सर्जरी इज, कि होती क्या है सर्जरी, उसके प्रेरेक्विजिट्स क्या हैं, उसकी क्या प्रोसीजर्स हैं, क्या उसकी प्रोटोकॉल्स हैं, और किस तरह से हम सर्जरी को परफॉर्म करते हैं। लेकिन अ, उसके बाद आपकी चीज आती है ऑब्जर्वेशन, कि आप किसी सर्जन को या किसी को आप सर्जरी करते हुए देखें कि हाउ दिस सर्जरी इज परफॉर्म। उसको आप ऑब्जर्व करें कि वो सर्जन क्या कर रहा है, और यू शुड हैव द बैकग्राउंड नॉलेज इन माइंड कि हमने ये सब चीजें पढ़ी हुई हैं जो ये प्रोसीजर कर रहे हैं। दिस ऑल थिंग इज नॉर्मल प्रोटोकॉल, इसके बगैर ये सर्जरी नहीं हो सकती। और फिर आप सर्जरीज को ऑब्जर्व करते हैं, द टाइम कम्स कि आपको इतनी स्किल आ जाती है कि आप वो सर्जरीज खुद परफॉर्म भी कर सकते हैं, और आप उसमें कॉम्पिटेंट हो जाते हैं। और इट इज बेसिकली सर्जरी होती क्या, इट इज स्किल ऑफ द हैंड। ये आपके हाथ की एक स्किल है कि कैसे आपने सर्जरी करनी है, और किस तरह से आपने जो है सर्जरी को लेके आपने चलना है। बिकॉज आप प्रैक्टिस है, और स्लोली स्लोली प्रैक्टिस मेक्स अ मैन परफेक्ट। ये आप प्रैक्टिस करते हैं और बार बार वो करते हैं, एंड यू हैव द राइट स्किल्स, एंड यू हैव द राइट नॉलेज, एंड यू हैव द राइट कमांड, तो देन यू कैन परफॉर्म सर्जरी। तो आई होप क्या प्रेजेंटेशन भी आपको शेयर हो रही है सबको, प्रेजेंटेशन।
यस सर।
हाँ जी। तो इसमें सबसे पहले आपको पता होना चाहिए कि सर्जरी है क्या। सर्जरी इज बेसिकली ड्राइव फ्रॉम टू लैटिन वर्ड shear एंड ergon. Shear means to cut and ergon means to work with hand. इसका मतलब है सर्जरी इज बेसिकली टू वर्क विद योर हैंड, क्योंकि मेडिकल प्रॉब्लम्स में देर आर सर्टन प्रॉब्लम्स जो कि मेडिकली या जो कि हाथ से विद मेडिसिन या विद डिफरेंट अदर जो आपने नॉलेज है आपका उससे ठीक नहीं हो सकती। तो देन सर्जरी इज द लास्ट सॉल्यूशन ऑफ दिस प्रॉब्लम। तो जो प्रॉब्लम सर्जिकल हैं उनको कोई और तरीके से हल नहीं किया जा सकता। तो यू हैव द लास्ट ऑप्शन, और सर्जरी को आपको परफॉर्म करने के लिए यू शुड हैव द राइट स्किल, एंड आपके वो सारा प्रोसीजर्स आपको पता होने चाहिए। तो वाई सर्जरी इज परफॉर्म, सर्जरी करते क्यों हैं। सर्जरी इसलिए करते हैं कि देर आर सर्टन प्रॉब्लम्स जो कि मेडिकली जिनका ट्रीटमेंट नहीं है, तो आपने उनको थ्रू सर्जरी हल करना है। जैसे अगर एक डॉग है, उसकी टांग टूट गई है, तो उसको आपने यू हैव टू करेक्ट इट विद योर with the help of your knowledge of orthopedic surgery. You have to bandage it, you have to make plaster of Paris, or you have to make internal fixation like pinning, plating, और other techniques आपने यूज करनी है। तो इसमें डिफरेंट ब्रांचेस हैं सर्जरी की, लाइक सॉफ्ट टिश्यू सर्जरी, ऑर्थोपेडिक सर्जरी। तो ऑर्थोपेडिक सर्जरी वी डील विद द बोन्स, मसल्स एंड जॉइंट्स। तो अगर जॉइंट्स के कोई प्रॉब्लम है तो दैट इज टू बी करेक्टेड थ्रू ऑर्थोपेडिक सर्जरी। बोन टूट गई है, आपने पिनिंग प्लेटिंग या करनी है, वायरिंग करनी है, कोई इम्प्लांट यूज करना है, देन इट इज हैज टू बी डन थ्रू ऑर्थोपेडिक सर्जरी। मसल्स की पेन्स हैं, कुछ आपने टेंडन्स के प्रॉब्लम्स हैं, लिगामेंट्स के हैं, ये सब प्रॉब्लम दे कम अंडर द डोमेन ऑफ ऑर्थोपेडिक सर्जरी। और सॉफ्ट टिश्यू सर्जरी में यू डील विद द स्किन, बॉडी कैविटीज, योर बॉडी सिस्टम्स लाइक cardiovascular systems, gastrointestinal system, urogenital system and respiratory system. If there is some abnormality in these systems, and they need surgical correction. So this kind of surgery is called as soft tissue surgery. Then there are system specific surgeries like neurosurgery, ophthalmic surgery, because these are all the specializations of surgery. If you are basically, you have learned the basic skills and you are a surgeon, then you have to master, select some domain like ophthalmic surgery or some orthopedic surgeon. You can become soft tissue surgeon, you can become cardiac surgeon, you can become neurosurgeon, you can select any of these specialities. And because there are lot of advancements and new research, and one man cannot fulfill, because it's such a vast subject that you cannot master all the domains. So you have to select one particular domain, and you have to master in that and specialize in that, and perform and become a good surgeon. So then there are two types of surgery. Basically, we divide them in elective and emergency surgery. Emergency surgery is that you have to do at the same spot, because you cannot wait. Life of the animal is at risk, and there is a bleeding, or there is if you don't perform surgery there, and then you don't have time, so animal can die if you don't perform surgery on the spot. And elective surgery is like we can postpone, we can, there is no threat to the life of the animal, and we can plan that surgery within some time to come, within some period of time. So what are the qualities of a good surgeon? How you should expect he is a good surgeon? He should have the following qualifications, following qualities. Like he should have the thorough knowledge of anatomy. So you have studied anatomy in your basic courses in first year. So in that you study that what a body is made up of: skin, bones, muscles, tendons, ligaments, different body organs, different systems, how they are, where these systems, how they look like, what is their, how they are made up of, their shape, their position, their location, their origin, insertion, their surrounding. Like you should know the structure, what is on its left side, what is on its right side, where it is coming from, where are the ligaments or some attachments to this structure. You should know the anatomy in detail. So to become a good surgeon, you should go through anatomy once again before you start studying surgery. And then there is the, you know, the procedure, how you perform a specific surgery. Like it's a simple minor surgery, like you have to perform some amputation of tail. You should know what muscles, what blood vessels are passing there, what are the nerves there, what are the bones at that point, which joints you have to go through. So you should know what you are cutting, what is under your scalpel blade. You should know everything minor detail, then you can proceed further. And then the surgery is a skill of the hand. And skill of the hand means that you perform suturing, you perform cut the tissue, you ligate the vessels. So this is all skill of hands. Your approach is very important, how you manipulate with the instruments, because a good surgeon, he only plays with the instruments. Like he does not knows what is happening, but he is doing everything with a very efficiently and very without thinking and without any problem. He performs the surgery and completes the surgery very skillfully and very efficiently within the very short time, and he has no problem. Why? Because he has a skill of the hands, and this skill comes with the practice. And you do some surgery, first of all you study, then you observe, then you perform. And if you have performed first surgery, you are performing first surgery, you are still not very master, you are performing under some, with some other surgeon, under some supervision. Then you do second, third, and a time comes that you also become the master, and you are doing it without thinking, without any studying, or without having any problem. You can do that surgery. So it is all the skill of your hand, and it is the practice. Practice makes a man perfect. You know the same procedure again and again, and a time comes that you are master in that subject. And then you should know the complications, because there are certain things during surgery that you must know that in this thing the complications may arise. You can have problems. You can have like, if you are ligating a blood vessel, you should know that by ligating this blood vessel, I'm going to block the blood supply to the system and the organs and the other next to where this blood supply is flying, the blood supply. So you should know, if you have to block it, then you have to see that there are some collateral vessels, or there are some other capillaries which can supply blood supply to the structures, so that they are not necrosed, or they are not there is no problem. So also this surgeon he has to be mentally very strong and with the strong nerves, because surgery is not something you have to be brave, and you have to be mentally prepared that you are going to do this kind of procedure. You are going to see the blood flowing, you have to see the blood, the muscles, the blood vessels you have to deal with, and you have to cut the tissue. So you should have strong nerves, and you should be a brave person if you are going to become a surgeon. So there are certain prerequisites of surgery. Prerequisites means there are certain requirements, basic requirements. Without these things, you cannot perform surgery, because surgery is all about your proper technique. And if you follow the protocols, you follow the prerequisites, then you can be a good surgeon. Your surgery can be a success. If you do the shortcuts and you bypass any of the procedures which are the mandatory for any surgery, then you cannot become a good surgeon. So how you proceed for the surgery? First of all, there are some prerequisites, some requirements. Like, you have to prepare the instruments. You need to have the right instruments for that particular surgery. You have to make a standard surgical pack. You have to select that I need this number of forceps. I need this much scissors. I need that plier. I need that hook. I need that needle drivers, different kinds of forceps, different kinds of mosquito forceps, like you need Alice tissue forceps. So you have to prepare a standard surgical pack. And for orthopedic surgery, like, you have to need different instruments. You need orthopedic instruments. You need hammer. You need bone cutter. You need some orthopedic instruments. So you have to plan a surgery, and you have to need the proper prepare a proper surgical instrument pack. And then you have to sterilize them, because sterilization is basic thing. Without sterilization, you cannot perform surgery. And if you proceed, if you bypass any of the procedure in sterilization, and there your even a single instrument is not sterilized, that can ruin your surgical procedure. So first of all, you have to prepare these instruments and sterilize them. First, you have to wash them properly. Then you have to keep them in the autoclave under high temperature and pressure for a certain period of time. And then these two instruments are sterilized and ready for use. Because sterilization, you define sterilization, that it is the process of removal of all kinds of microorganisms, bacteria, virus, and fungi from the instruments or from the surgical field. It is called sterilization. So if you have to attain sterilization, then you have to keep your surgery attire. That surgeon has to prepare properly. He has to wear the scrub suit, he has to wear the gown, the cap, the mask, and he has to be in a proper attire for surgery. And no unnecessary person has to be there. Only surgeon, assistant surgeon, and his team and anesthetist. No unnecessary person, because there is some protocol of the operation theater. It's not a common room, and not everybody is allowed to enter there. Only surgeon and the concerned people enter that place. and then you prepare that surgical area where you have to perform surgery. You have to sterilize the table, in the table where you have to put the animal. You have to sterilize the animal's body. Like animal's body, there could be many microorganisms on the skin. You have to scrub, you have to shave I'll discuss all these things in the next slides, but you should know that these are all the requirements of the surgery. Then during the surgery, animal has to be taken care of by the anesthetist. He has to keep the animal in a good plane of anesthesia. If animal is disturbed or is moving or he is not in good anesthesia stage and or his life is at risk, then there could be any problems and you can face. And these are the duties of the anesthetist, that he has to take care of the patient during surgery, and surgeon has to be free of mind from all other things, and he has to do only the surgery. He has to use the instruments and perform his work, and assistant and anesthetist, they do their work. And basically surgery, it is a teamwork, because it's not a one man job, it's not a one man show. He needs assistant surgeons. The surgeon needs his team, like anesthetists, like the people who do the pre-op. Pre-op means to prepare the patient before surgery, to put the IV catheter, to to shave the animal, to scrub the animal, to keep the animal off feed. All these are the duties of the team which has to prepare the animal pre-op. Then there's a surgeon, then assistant surgeon, then they have their duties. Assistant surgeon has to prepare instruments, anesthetist has to cannulate the animal, he has to perform pre-anesthetic drugs, then he has to do induction, then he has to maintain the anesthesia, then he has to perform monitor the animal during the recovery, and after recovery, then if the animal is completely out of anesthesia, then the anesthetist duty is over. The surgeon duty is just to prepare himself mentally. Then he has to prepare himself in the proper attire, dress up. Then he has to scrub his hands, wash his hands properly. Then he has to wear the gown, mask, cap, and then he enters the operation theater. And instruments, they are ready, already done by the assistant surgeon, autoclaved. The instruments are there. The animal is there by the pre-op team. So all these things have to synchronize like at one time, because the surgery is performed on a specific time. If the surgeon is planned surgery at 12 o'clock, so before 12 o'clock, everything should be ready, like instruments, like patient preparation, like shaving, scrubbing, everything is ready. And then the surgeon enters at 12 o'clock, he does his work, animal is ready, all instruments are ready, all materials are ready, all aseptic measures have been adopted, and he performs his surgery. And after surgery, the surgeon can move, he can go back. And then there is the duty of the team which has to take care of the post-operative care after surgery, to shift the animal, to perform daily care of the animal. This is the team duty of the post-op team. So this is all very important things. So how you prepare the instruments? So there are many methods to prepare the instrument. Like first, you wash the instruments. First of all, you prepare for every surgery a standard surgical pack. Like in orthopedic surgery, you need different instruments. For neurosurgery, you need different instruments. For ophthalmic surgery, you need different set of instruments. So you prepare the instruments, then you have to sterilize them. Then means there are many methods of sterilization. Some of the physical methods like heat, radiation, or filtration. So there are different filters which are rarely used, but radiation is also not very common. Infrared and X-rays and gamma rays, ultraviolet rays are used, but they are not very common in our conditions. We use heat method, that we either if we boil the instruments, but that is also if the possible, if autoclave is not available. But best thing is that if you have autoclave, you pass them through autoclave. And there are different types of autoclaves available in the market. You can use dry heat, you can use moist heat. Like in autoclave, you need steam, moist heat. So temperature is very high, above 100 Celsius temperature, and under high pressure you maintain it for 15 to 20 minutes, and all the microorganisms, they are dead. And they're also possible through dry heat. Now there are hot air ovens are available. You can use flaming, red heat, incineration. These all methods are being used to sterilize. So all the efforts should be made to sterilize the equipment, and you should use disposables. Some of the instruments, they are sterilized, they are blister packed, and some of the materials which are to be used during surgery, like the suture materials, they are already packed in a blister pack. They are sterilized. You open them at the time of surgery. You don't need to autoclave them, and they are already sterilized. You open them and use them, and then you throw away the rest in the dustbin. You don't reuse these things because they are, once they are open, they are not sterile. So pre-operative considerations also need, because the animal which has to be operated upon, you need to examine its health, how healthy he is, he can withstand, or he can go through that surgery, he can bear that surgical procedure or not. Because surgery is not very simple or very, it is a stressful thing, because you can expect bleeding, you can expect trauma, injury. You need a healthy animal which can heal after the surgical procedure. If animal is emaciated, animal is weak, animal is very suffering from some disease, you cannot perform surgery on that. You should simply excuse, or you should postpone the surgery. This is a surgeon's decision. After checking the animal, he can postpone the surgery. If it is not an emergency surgery, you can say that, okay, get the animal in a good health, or check his blood work, like CBC, LFT, RFT. You can get a picture of his health status, like animal is having a good liver function test, has a good kidneys are normal working, the hemoglobin level is good, RBC count is good, WBC count is not too high. All these parameters, you have to see the hematocrit. All the parameters are in the normal range, then you can expect, it means the animal is healthy, you can go for surgery. If the LFT is very poor, animal is having jaundice or icterus, then you cannot perform an surgery on that animal. You cannot expect that animal to heal out of surgery. If the kidneys are compromised, urea level is high, creatinine is not good, then you cannot expect that animal, that you are using so many drugs, anesthetic drugs, they will not be eliminated, kidneys are not normal, and animal will not survive out of surgery. So all these thing is pre-anesthetic management, that you have to see all the parameters, and you have to correct the parameters, and you, before performing surgery, you have to see the animal, you have to examine, you have to do the blood work, then you perform surgery. And also before surgery, you need to, fasting is very important. Fasting, keep the animal fast for at least, in case of small animals, dogs and cats, you can use 8 to 12 hours fasting. And in case of, for major surgeries, and in case of large animals, you should fast them at least 24 to 48 hours even. So that all the GIT is clear, there is no vomiting or regurgitation of food, stomach is empty. So the results of the surgery are good. Otherwise, animal is under anesthesia. There could be aspiration. The vomitous material could be aspirated, and animal can be suffer in another problem. So in this slide, you can see there is a shaving of the patient. So this have to be done before surgery. One day before surgery, you should perform shaving of the preparation of the surgical site, like the area where you have to perform surgery, you have to cut, you have to perform the incision, that area should be properly shaved off. It's not the shaving only with this shaver, electric shaver, or with the scissor. The shaving is with the blades, like you perform safety and blade, and properly you shave that area, so that there is no evidence of any hair, because hair are always problematic, and there is a combination of debris and bleeding and material and around on the hairs. So that area should be properly clean shaved before surgery, and then you perform before surgery, the animal is scrubbed. Animal skin, that area where you have to perform incision, that area is scrubbed. Scrubbed means you have to properly रगड़ना जिसे कहते हैं, अब उसको एंटीसेप्टिक सोल्यूशन लगा के, सोप सोल्यूशन लगा के, लाइक पायोडीन स्क्रब और अल्कोहल और सम good scrubbing material you put there, and you rub the skin, and so that their skin has pores and the dust and debris is accumulated in the pores, and all that area could, there could be microorganisms could be residing there. So you scrub the area and you clean it so that all that area is ready for surgery. After this, you apply that some strong antiseptics on it, and after scrubbing properly, washing, you can make 2 or 3 cycles of scrubbing. You, it means that you have to apply scrub, then you have to wash, then again apply scrub, so that all the skin layers are properly cleaned. Then you have to use the drapes. What is a drape? Drape is a sterilized piece of a cloth that is used to cover the body of the animal so that only the surgical field is exposed. The place where you have to give incision, that area is exposed. Rest area is covered with the sterilized piece of cloth, so that because you have scrubbed only that area of the skin where you have to give incision, not all the body, not the hairs, not the surrounding body parts, because animal body is not normally very clean. It is, even you, even if you bathe the animal before surgery, one day before surgery, still he has microorganisms on the skin, on the hairs, on the around, and then animal is on his has the infection around the perineal area, around the mouth area. So all the body should be covered, and only the visible area should be the place where you have to give incision. So you have special instruments like towel clamps for this purpose, and you apply the towel clamps on that area. Around you have to, you need 4 to 5 pieces of cloths. 4 pieces of cloths you use like this, like on the right, on the left, on the door side, on the upper side, and you on the corners you put the towel clamps, and in the clamps you take pinch a piece, a little part of the skin also, so that it does not moves from there. The cloth is fixed with the skin and it does not move during surgery, and animal is in the anesthesia stage, there is no pain. So you apply the drapes when animal is in the induction stage of anesthesia. So next you perform the draping. You put another drape, like in this you can see the towel clamps, and in the next slide you can see that there is another piece of cloth which has a slit opening, which is the final drape, fifth piece of the drape you put on this, and only the exposed area is visible, and the towel clamps are below this piece of final drape. So this is the fifth piece of the drape. So animal preparation is very important. Completely, you shave the animal, scrub the animal, and then you put the IV catheter. You also, you can put, because animal is in the anesthesia, you can put some ophthalmic ointment or some glycerin drops to the eye, on the eyes, because if you don't put that, the eyes of the animal, they are open during anesthesia, and this can cause corneal dryness, and cornea, if it dries for 2 or 3 hours, there is no blinking of eyes, though if they dry, it is a problem with the, they could, animal could be blind after surgery. So you have to put the some lubricant on the eyes, then remove the hairs, debris. Then you, after that you move the neat and clean animal to the operation theater, because you cannot do these things in the operation theater, because operation theater is a sterile area, and you can use betadine, chlorhexidine solutions, or you can use pyridine scrub, povidone iodine solutions to wash the area, and then you wipe it. And the last, you wipe it either with 70% alcohol or a sterile water or saline you can use to wash that area. And after that, now you can expect that the animal is ready, and then surgeon can start the surgery. The Then there is a steps in the preparation of surgeon. The surgeon has also to wear the proper attire, the scrub, the clean. The surgeon never wears the boot or shoes or socks. He has to be in the slippers. Okay, and he has to wear the scrub suit, which is a greens called as green piece of the scrub suit. You know, everyone you have used during your clinics, and shoe covers. Maybe use the surgical mask and cap, mask, and gown. So, how you perform hand scrubbing? How the surgeon, after wearing the scrub suit, he enters the scrubbing room, because it is scrubbing room is a special room which is attached with the operation theater. It has the tap, specialized tap. For washing the hands of the surgeon, so surgeon has to perform 6 minutes scrubbing procedure, and during 6 minutes he has to perform 3 cycles of scrubbing. He takes the soap. The soap is not you don't have to touch the soap container. You just have the liquid soap dispenser, or you have put the bottle like this, and so that the antiseptic scrub solutions flows on your hand. Then you scrub your hands, means you scrub on the finger palm, the back of the hands, the finger webs, and then you wash the area up to the elbows. You have to properly wash and you have to make the lather, and you have to rub it for at least 2 minutes. After 2 minutes, you wash, rinse the on the in the tap. The tap is also has a pedal tap or a elbow operated tap, so that you don't touch the tap and to open the tap to open the water flow, so that if you touch anything you will break the sepsis. So if you maintain the asepsis, you have to properly maintain these all protocols of washing, how you have to wash your hands. So you have to complete follow the all the 6 minutes procedure, and you have to don't have to put your hands on the downside after washing your hand scrubbing. You have to put your hands on the upward direction, so that the water flows from your fingers to your arms, and then to your elbows. If you make it the hands down, the water flows from your elbows to your hands, arms, and on your fingers, and it will also break the sepsis. You keep the hands upside after rinsing them properly, and then you need sterilized towels to dry your hands, because if you don't use sterilized towel, you can still break the asepsis. Or you can use the hand dryers. Now there are hand dryers available. You can on them, and you can put your hands under the hand dryer, and you can dry your hands. After drying your hands, you have to wear the surgical gown. Surgical gown is normally it is sterilized disposable gown, which is worn, and your assistant helps to tie the knots on the back of you keep standing, and your assistant is can help you to the tie the knots on the back of your gown, so that the gown is fixed. Already you wear mask and cap, and then you have to perform gloving. Gloving means you have to wear the gloves, because your hands, even you have washed your hands for 6 minutes, there are you need to expect they are clean, but you have still to wear the disposable surgical gowns, which are properly clean, and they are 100% is sterile. So aseptic surgical technique, you have to follow all the measures to prevent the infection. So you need sterile drapes to prevent contamination on the incision side. Then instruments and supplies. You need any supply, like you need some suture. It has to be sterilized, and you can include that in your surgical bag. Okay. Are you understanding everything? Your people are attentive or not? Any question up to this point you can ask.
नो सर, समझ आ
Yes.
रहा है सारा कुछ।
Mm. Okay. So I am continuing my lecture. So you prepare sterile instruments are already taken out of the autoclave and they are spread on the instrument trolley. You have a special trolley for the instruments. So you put the instruments there and then you have the surgeon is also already prepared, patient is already prepared, and you are now you can start surgery. So for surgery, the you need proper instruments. This is a picture of standard surgical instruments which are used. The small animals there are instruments are relatively small, and for large animals you need big instruments like big scissors, big needle holder, big towel clamps. For small animal you need small tissue forceps, tooth forceps. So all these instruments you can see that there are of different types and different shapes and different you have to use right instrument at the right place, because every instrument is made for certain purpose, for certain use. If you use proper instrument for the right place, then it will work. You will work will be efficient, your work will be smart, you will be easy to work for you. So you need at least 4 to 8 6 or 8 mosquito forceps or hemostats they are called. You have to stop bleeding to hold the forceps. They are used to hold the bleeding vessels during the surgery. Then you need the towel clamps to fix the drapes. You need a needle driver to hold the needle while surgery and drive the needle. And you need scissors, different kinds of scissors like myo scissor, like medicine bone scissor. You need suture cutting scissor. You need dressing bandage cutting scissor. All these instruments they are very important, and they have to be maintained in a very aseptic measures. They have to prepared. You need different kind, like in spaying you need spay hook, which is a special hook which has used to capture the uterus while you are performing spaying. Then you need scalpel handle. You see that it has a very special shape. It has and you need you mark in the market there are surgical blades available in different shapes. Some have sharp edges, some have curved edges, some have so they are also available in different sizes, like you can use 22, 23, 24 number needle scalpel handle, and it has some corrugations where you put your thumb and you put pressure. And you also need different sets of scissors like myo scissor, which is only used to cut the muscles, medicine pawn scissor, which is used to cut the tissues. It's a stronger scissor. Then you need a bandage cutting scissor. You don't use one scissor on the other place, because if you don't use the right instruments at the right place, you will spoil the instruments. Your work and your efficiency will be poor. So there is the different types of needle holders like Olsen-Hager, Olsen-Hager needle holder, Mayo-Hager. The Mayo-Hager has Olsen-Hager has special blade on before its jaw, which is used to cut the suture material after performing the knots. You have to can cut. Then the next picture you can see this is a Matthew needle holder, which is self. It has a locks and it is very efficient to work. And when you are performing and your work become easy. Then you should need to know what is the suture material. What is a suture? Suture material is anything which is used to bind the tissue. You bind the tissue with the help of suture material, and because there is a space, the gap, you have to make the two tissues together with the help of suture material. So different types of suture material are available, like absorbable, non-absorbable. Absorbable are used in the internal body cavities, muscles, tendons, body organs, so that they are don't need to open. They are dissolved in the body by the enzymatic digestion. And non-absorbable you always apply on the skin, on the external, so they can be opened once the skin wound is healed. So natural, they are divided into different, like natural, like synthetic, like monofilament, multifilament, or other kind of. There are classifications. Basically, we use catgut. Uh, Catgut is available in two forms: plain catgut and chromic catgut. Plain catgut is has less life. It means its tensile strength. It loses its stays in the tissues for a shorter period. Whereas if it this catgut is treated with the chromium salt, and then you can use mm, this catgut. Its life is increased because the chromium, it is absorbed very slowly, and it provides the suture material holding power for a longer period of time. Similarly, collagen is used, Vicryl is used. Vicryl is a synthetic material. Collagen is also natural. It is made from the tendons or tendons in different thickness. These suture materials are available, and according to use need, you can the companies, they prepare them and they are sterilized and blister pack them. You can ask before surgery. You can write down what kind of suture material you need, what thickness you need. You need monofilament, you need multifilament. Then you can also write what kind of needle you need, because needle is already fixed on these suture materials. So you can ask for the straight needle, you can ask for the curved needle, you can ask for the half circle needle. All these, it's your choice. The surgeon has to write before surgery. If it's a dog, you need a different thickness. If it's a cat, to be surgery, you need different kind of suture material, different thickness. If it's a horse, you need a thicker, you need strong suture material. So after this basic requisites, one more thing is very baseline of the surgery. Without this, surgery cannot be performed. This is anesthesia. Anesthesia is just to because make the animal unconscious for a temporary period. So anesthesia is defined as a loss of senses. And aesthesia. Aesthesia means senses. So as that all the senses are lost, it is anesthesia. So it's a loss of sensation for a temporary period of time. It's a you can also say it's a reversible loss of consciousness, which means that animal has for a certain period of time it has to made senseless so that you can perform surgery, and then it has to be awake and normal, it returns. So anesthesia is a very important subject and very important. It is a complete subject. There are books on this, but I will try to tell you some basics about anesthesia. Basically, we divide them into two types: local anesthesia and general anesthesia. General anesthesia, we sensitize the whole CNS, and in local anesthesia, we sensitize only a specific part of the body, some organ or some region, and we perform our work. So, local anesthesia is a very useful technique because you don't have to, because general anesthesia has its own side effects and some problems. So you avoid those problems by performing local anesthesia. So before anesthesia, also you need to keep the animal on starvation, because some of the drugs like xylazine, it has a side effect of vomition. Animal vomits and defecates after this because it's a very good muscle relaxant, and it has a vomition property. So animal has to keep starved so that there is no vomit, and is so starvation, or one day before you stop feeding, or at least in small animals you need to be have starved 6 to 8 hours, maybe 12 hours. Then after before anesthesia also you need laboratory evaluation like blood work, CBC, LFT, RFT, physical examination of the patient, like you see the mucous membrane, you see the body temperature, you see the heartbeat, pulse rate. All these things help you to perform the pre-anesthetic evaluation. The heart of the animal is normal working, there is no problem. So, so that an animal is in a good health to get the anesthesia. Because anesthesia, weak or diseased animals, sick animals, they don't bear out anesthesia, and they can be anesthetic emergency, and they can die during surgery, before surgery, or after surgery. So you should be animal should be perfectly in a good condition. You can evaluate by lab work or physical examination. Then IV catheterization is very important. Venipuncture. You have to puncture the in dogs we puncture sphenic vein, in cats also we puncture the sphenic vein, and for blood collection we can use jugular vein, but most commonly sphenic vein is used to fix the granula. So this is the red line indicates that where the vein is passing sphenic vein, it comes from the middle side of the tarsal joint, carpal joint, and it goes upward on the lateral side of the elbow. So you have to hold the animal in a proper way like that, and you have to press the and stop the blood flow on the backward on the at the point of the elbow on the cranial side of the forearm, and you press it and the vein becomes prominent. Then you have to shave that area with the help of electric shaver. Then the vein is prominent and you have to perform IV catheterization for small animal. The cat you use 24 number granula. For dog you need 22. Even a larger dog you need 20 number granula. So granula fixation is also a very minor surgery. You need to puncture the vein at the right place so that granula is inside. Then you have to fix the granula with the adhesive tape and properly prepare the patient so that during anesthesia, during surgery, you need some medication, some kind of drugs, life-saving drug you need, or you need to deep the anesthesia in case of injectable anesthetics. You also keep the fluid therapy like the drip is on so that animal is not dehydrated, or so that, and you can put any kind of anesthesia through the IV catheter. So it's a basic thing. It should be done before starting any procedure, any surgery, or any anesthesia. So different anesthetic drugs are available. So first you perform and give pre-anesthetic drug which are used to perform sedation. Sedation is to calm down the animal, just to animal is awake but calm. Animal may be standing but his head is down. His body is relaxed, but he's still in his senses and he can move. Some, but staggering is there. So the sedation has different forms like mild sedation, deep sedation, moderate sedation. So you can use the drugs, sedative drugs, in different doses uh, to achieve if you need mild sedation, moderate sedation, or deep sedation. So these drugs are normally used are espromazine, diazepam, midazolam, xylazine hydrochloride, medetomidine, detomidine, dexmedetomidine. So these all drugs are pre-anesthetic drugs. It means they are used before anesthesia just to calm down the animal, just to sedate the animal. And these drugs they have anesthetic sparing effect. It's what is anesthetic sparing effect? It means that these drugs they reduce the dose of the general anesthesia, because now these are pre-anesthetic, you have to give general anesthesia. So if you use pre-anesthetic, you need less dose of the general anesthesia. So romifidine, metromidine, xylazine, all these drugs can be used for sedation. Then after sedation, you have to perform induction. Induction means during sedation, you can perform IV catheterization so that animal is IV cannula is fixed, and after you have to give induction. Induction means transition from the awake state to the anesthetized state. That awake state in sedation, animal is awake, but after induction, animal is in the complete third stage of anesthesia, anesthetized state. So for induction, you can use different drugs like CAR, ketamine, atropine, xylazine. This is the most commonly used drug in our practice. Ketamine, atropine, and xylazine used in the ratio of 7:2:1, according to the body weight of the animal. And animal is in the third stage of anesthesia, is induction as achieved. You can also use ketamine, medetomidine, and xylazine. Do not use xylazine or medetomidine altogether. You can use either medetomidine or xylazine with ketamine. Medetomidine is 5 to 40 mcg per kg and ketamine 2 to 5 mg per kg. IV or IM, it can be used. If you have a catheter, best way is to use through IV. It gives the prompt result, the fastest result, and after sedation, your animal goes into the recumbency, means animal is senseless, anesthetized. You can also use combination of ketamine or diazepam, ketamine or midazolam. These are drugs combination. These are called cocktail anesthesia. Combination of two or more drugs is called as cocktail anesthesia. There is also a very good drug available, tilazole, which has tilatamine and zolazepam. It is used tilazole 4 mg per kg IV. It produces very deep sedation, or even the light anesthesia it also gives. So animal, you can also use pentothal sodium, which is very good drug, but it is not available nowadays. 15 mg per kg IV pentothal thiopentone sodium. It's a barbiturate. You can also propofol 6 mg per kg, 10 mg per kg, up to 10 mg per kg you can use to achieve the anesthetic induction. So, but it has propofol and thiopentol. These are barbiturates. They have side effects. They are ultra short acting anesthetic drugs, and they are also they cause respiratory arrest, sometimes apnea. Apnea means the stopping of breathing for a certain period of time. The breathing is stopped, which is a dangerous stage. So these drugs are not preferred. We prefer the safe drugs, which are latest and new safe drugs. So your for anesthesia and for even for other medication, there are six rights. Means you have to see the right patient. Right patient means that you should know you are working on dog or a cat or a elephant or a horse. Which patient is there, you should know, so that there some drugs are specific for certain animals. Some drugs are have different dose in dogs. Some like xylazine, it has a different dose in dogs up to 0.1 mg per kg, and in case of ruminants it is very low dose, like 0.01 mg per kg. It's 10 times less dose in ruminants are. So ruminants are very sensitive to xylazine. So you should know what patient you are and the right drug. The drug should be always of good quality, good drugs you are using. It means you are using ketamine, it should be ketamine. It should not be some other drug. You should be in your senses because you are performing anesthesia. You should, there is no chance of any error. You should not follow the any other instruction. You should use the right dose. Right dose for calculation, you need a weighing balance for the animal. Like animal, you should know the weight of the animal before any anesthesia, before any surgery, to calculate the dose of the anesthesia. Then the dose of the drugs you have to calculate, because it's always in mg per kg. Then you need to multiply it by the weight of the animal. That for this 20 kg body weight, what dose of the anesthesia we need, you have to calculate and you have to prepare it. And you should know the right dose of anesthesia, because a little bit difference or little bit error can kill the animal. So also you should know the right route of administration, like if it is given IV or IM or subcut, you can expect different response. In IV, you can expect prompt response. The needle is still in the vein and the animal is in the anesthesia. Animal achieves the anesthesia. And in case of IM, you can expect 30 seconds to 1 minute to achieve the anesthesia. In case of subcut, you can expect 5 minutes, 10 minutes to achieve anesthesia, maybe longer period of time. And right time and means that anesthesia or some other drugs, they are used at the proper time, like in the morning or evening, or if the doctor advises to give the drug at the daytime, in the night time, what time you are giving. Right frequency means it is to be given once in a day, twice in a day, thrice in a day, 4 times in a day, all these things. Because in case of anesthesia, in case of any other drugs you are using, these six rights are very important. Inhalation agents. There is after induction anesthesia. I have told you, first of all you do pre-anesthetic, then you do induction with the help of injectable anesthesia like ketamine, xylazine, atropine, like xylazine, tilazole, tilatamine, dilazepam, or some other drugs. You can use combination for achieving the induction. And after induction, you need maintenance. Maintenance is uh, done in gas anesthesia normally. Best protocol is gas anesthesia. If gas anesthesia is not available, you can use injectable, but best and safest and for longer period surgeries, you need gas anesthesia. For this, you need a proper gas anesthesia machine. But you should know what drugs you have to use, like general anesthesia you can achieve with the help of isoflurane, halothane, sevoflurane, desflurane. These are given via endotracheal tube. You can sometimes you can use face mask to give inhalant anesthetics. So you need to know the proper dose, proper way of using this anesthesia, gas anesthesia. I will also explain this. So anesthetic agents, isoflurane, halothane, sevoflurane, desflurane, these drugs, they are used. And first you have to put the endotracheal tube in the mouth of the animal, in the trachea, through the mouth, and from the larynx, you should know the laryngeal structures. Epiglottis is very important. So use of laryngeoscope, there is an instrument which has a light torch on it, and it is also a tongue depressor on it. It's a stainless steel small instrument. I'll show you in the next slide. It is used to facilitate the intubation. So anesthetized animal, in case of and after induction, you put the endotracheal tube. So correct placement of his endotracheal tube is very important. If it is a little error, it can enter into the esophagus and into the esophagus. So you have to be very careful. You have to see properly. And in the next slide, I'm going to show how you hold the animal for endotracheal intubation. Endotracheal tubes are available in different size. In cat, it's less diameter. In dog or bigger dog, different diameters, 8 to 12 thickness, they are available. And for an average 10 to 24 kg dog, you can use endotracheal tubes of different sizes. And there is a cuff or a balloon on this, which is sealed to prevent the aspiration of regurgitates and also to maintain standard depth, because now after endotracheal intubation, animal is breathing through this tube. Air expiration is through this tube only. So there is a small cuff on it, a balloon, which is used to show, which is inflated. There is a small piping with it. You inject air with the help of a disposable syringe, empty disposable syringe. You take air in that syringe, you inject air, and that balloon is inflated, and it blocks the lumen of the trachea, and the breathing is only through, and also it prevents the regurgitation. So these tubes you can see there are of different diameters, and this blue piping and part is the small is a area for inflation of the balloon, so that it is fixed inside. So the assistant holds, and this animal is in the anesthetized stage, induction stage. The assistant opens the mouth like this, and the assistant has laryngoscope in one hand. It's a stainless steel instrument you can see in the picture. On one hand with the laryngoscope, it is also used to depress the tongue, to press the tongue on the downside, so that the laryngeal apparatus is available. Then you see the epiglottis, and you move the epiglottis forward, and you so that the tube enters into the trachea. You advance the tube, and then you inflate the balloon so that tube is fixed, and then this tube is tied with the bandage with the upper jaw, so that it does not move. And with the this endotracheal tube, you attach the gas anesthesia machine for maintenance of anesthesia. So all this effort we are doing to achieve the maintenance of anesthesia, which is our basic requirement. Then these are the parts of the anesthesia machine. Anesthesia machine is very important. I will show you on the next 3 4 slides. There is an anesthesia machine, but these are the cylinders, gas cylinders, which has oxygen, and it is a gauge, oxygen gauge. On it, these cylinders are available in the market. You need them for gas anesthesia machine or intensive care, for oxygen supply. You need these cylinders. Then there is a right side picture of the vaporizer, which is used to vaporize the. You put the isoflurane in this, and it vaporize it. It's a part of the gas anesthesia machine. So to chain the maintenance with the help of gas anesthesia after endotracheal intubation. So recovery after maintenance recovery is very important. Means that the last stage one surgery is completed to remove the anesthesia machine, and you need to animal come out of the anesthesia. Animal has to be monitored during stage. The animal has to be taken care of its temperature, its breathing. Oxygen supplementation is very good during recovery. Endotracheal tube remains until the time the dog regains and a recovery, and then you remove the endotracheal tube. Animal, you can use also here some reversal agents like atipamazole, like which are romifidine, which is used to uh, atipamazole is a antidote of anesthesia. Means it is a reversing agent. On recovery, you need to give these injections so that the anesthetic effects are uh, removed and animal comes out of anesthesia. So in the next slide, you can see the anesthesia machine. Anesthesia machine is a very specialized equipment. It has monitors, the latest equipment. This is a picture of the most modern, latest anesthesia machine, which has monitors, which shows the ECG, which shows the pulse, temperature, the heart rate, the respiratory rate. It has it has the different. It's mounted on a trolley, and it has the all the equipment like vaporizer, like flow meters, like different. It's an electronic latest machine. We used to see the previous machines which are simple, but this is also very advanced anesthesia machine. It has the reservoir bag, it has the CO2 absorber, it has vaporizer which produces vaporizes and converts the liquid anesthetic into the vapors and enters. It is also supplied with oxygen cylinder with the help of hoses and pipes. So this is a basic structure of the gas anesthesia, how it works. In the CY piece on the right side on the top, you can see it is connected to the endotracheal tube. Then there is inhalation tube and exhalation tube. Two tubes, there is a different pipes, two pipes. One is for inhalation. It has inhalation valve, which is open once animal inhale. When the animal exhales, this valve is closed and the exhaled gas enters into the other pipe, exhalation pipe. And then there is exhalation valve, which is open when the inhalation animal inhales and the inhalation valve is open. So you can see that it's a rebreathing circuit. The exhaled gas, it goes to the CO2 canister, which has a scavenger system which absorbs the excessive CO2, because expired gases has the CO2, inspired gas has the oxygen, which is a fresh gas and which is entering. And also there is a reservoir bag or pop-off valve is there. There's a reservoir bag to, which is an important component of the scavenging system. And there is a pressure gauge showing the anesthetic gas pressure which is entering the lungs, because if the pressure is more, the lungs can collapse. They can because certain it has to go in certain pressure. Otherwise, there is a problem. So you can see the pipeline supply. You can see or there is vaporizer inlet pore, oxygen fresh valve. The oxygen is flowing and oxygen is flowing, and vaporizer also adds the isoflurane in it. There is a flow meter which monitors the flow of the fresh gas, because line pressure gauge and there are different gauges which tell you the what pressure is being maintained, because oxygen is under very high pressure in the oxygen cylinder, and there are pressure reducing valve which reduces the pressure, and it enters into the animal's body and it maintains the gas anesthesia. So the You can also see that there are cylinder gas supply and pipeline gas supply, gas inlets, pressure reduction valves, flow meters, flow meters, vaporizers, common gas outlet, breathing circuit. So these are all part of the gas anesthesia machine, and how this is the circuit showing how the gas anesthesia machine works. Uh, so we start local anesthesia. There are the different dental blocks of the forelimb, hind limb. You can desensitize different parts like infraorbital nerve. You can block to for some dental problem, maxillary nerve block, inferior alveolar nerve blocks. You can perform these to achieve good achieve the local anesthesia. Then blocks of the forelimb like brachial plexus, radial ulnar median nerve block, then blocks of the back limb, hind limb, then the blocks of the different sides you can block. Uh, So these are the dental blocks, and dental blocks. If you want to remove this a tooth, you can give the anesthesia injection into the superficial block, and infraorbital nerve you can block at this point. You can block maxillary nerve at maxilla bone at this point, just proximal to the. You can sedate the animal for this kind of blocks, and inferior nerve block, mandibular nerve block, so that you can perform some dentition. You have to remove some tooth. It's a very painful procedure. You can use these blocks. Then you can use epidural anesthesia. It means it to desensitize the whole perineal area, the back side of the animal. All is desensitized with the help of epidural anesthesia. So, local anesthesia, local anesthetic drug, lignocaine, hydrochloride, or xylocaine, or bupivacaine, you can use these drugs 2 to 4 ml, in large animals up to 10 mLs into the epidural space just above the dura mater in the spinal cord. You can give these injections, and these are very useful technique. Like you can do C-section, you can use episiotomy, you can use do tail docking in this surgery, you can do any procedure in the perineal area. There is prolapse, rectal prolapse, uterine prolapse. You can use epidural anesthesia to fix those problems. So this is the picture showing the epidural injection. It is given on the backbone, just last sacral or first coccygeal or sacrococcygeal joint, or intercoccygeus. You can enter in the L1, L2, even you can give lumbar vertebrae in the epidural space. You need spinal needle for this, and you need local anesthesia, lignocaine, and you inject in the epidural space with, and you can achieve epidural anesthesia. So let's come to the topic of our surgeries, because what are the major common surgeries performed in small animals, or these include sterilization. Such sterilization means to remove the reproductive organ. Animal is sterilized, like animal is no more male or female. Its ovaries and uterus are removed. In case of male, the testicles are removed. Then we perform orthopedic surgeries. We can perform cesarean section to take out the fetus from the pregnant bitch if there is a problem in delivery. Then we can use gastric volvulus dilus (GVD), gastric volvulus gastric dilatation volvulus complex. It's a problem which is called as blot. We perform surgery. Sometimes it is relieved with the help of a tube also, but to remove the gas. But in certain cases, you have to perform emergency surgery. You can perform cystotomy, incision on the urinary bladder, and you can perform end-to-end anastomosis in case of foreign body in the intestines, linear foreign body, or some intestine are in case of volvulus, in case of torsion, in case of intestinal torsion, some problem, you can use end-to-end enterotomy and tractomy, or end-to-end anastomosis. Then you can perform colopexy, gastropexy, gastrotomy, All these surgeries are normally practiced in small animals. You can come across these cases and you have to perform surgery to solve this. So first of most commonly in a veterinary practice as a small animal practitioner, you experience surgery. Most commonly is ovariohysterectomy and castration. So these are the spaying or neutering. You can see that for animal welfare also to reduce the dog population. You people bring their dogs, and the dogs, the cats, they have very bad behavior in the homes when they are in heat. So to remove, correct them, you need to perform these surgeries. So also there are some kind of tumors. Sometimes there are uterine tumors. You have to remove the uterus, ovarian tumors, cervical tumors. You have to remove the uterus and cervix also. And in case of some infection, pyometra, when there is uterus is infected, you have to perform surgeries. So I'm telling you why this OVH is performed to reduce population in case of cystic ovaries, in case of hyperplasia of the uh, ovaries or different these are the indications. So how you perform this surgery, you have to prepare the animal. I have told you the preparation, all the protocols to follow. Prepare the animal on the midline glycus, and you have to perform this in midline. So in CN you have to give, and in case of large animals you can give in CN on the flank, because in they have ingesta is very large. Rumen is there in ruminants, so we perform flank surgery because ingesta is weight and the suture line is broken. There's so much weight of the ingesta. So in small animal we perform midline. So you give incision from umbilicus to downward, you on the skin, subcut tissue, and then the linea alba. You have to approach through linea alba. You cut it, and after cutting the peritoneum layer, you enter into the abdominal cavity. Then you have to identify and bring out the uterine horns and the ovaries. You follow the ovary and you break the ligament. Dispensary ligament of the ovary. And after breaking that, the ovary can be exteriorized out of the abdominal cavity. Then you have to ligate the uterine arteries and the veins, the uterine pedicle, and you have to properly ligate them by three clamp technique. You put three artery forceps and you ligate in between first and two, and then you cut between the second and the third, and then you check the ovarian stump for any bleeding, and you break the ligaments, the uterine ligament, and then you remove one horn. In the similar way, you follow the second horn and you remove the second horn through the same procedure and check the stump, and then you have to perform ligate the uterine artery, middle uterine artery, which is running parallel to the uterine horns. You have to ligate on both sides, and then you perform transfixation of the you, of the uterus, the body of the uterus, just above the cervix, and then you apply three clamp technique and remove cut the stump. Then you have to check the uterine stamp that it is not bleeding, and then you put it back in the abdominal cavity, and then you have to suture the abdominal wall. First of all, the linea alba or the muscles. If you have to suture them through simple interpreted using vicryl most commonly. In case of dogs, number 0 or 10 vicryl you can use. In cats, 20. So different you have to select the correct. So next picture, it is showing the anatomy of the not this one, but two or three slides back. Jawad, if you are operating the yes, this picture is showing ovary, then the horns of the uterus, then the uterine uterine body, then the cervix, then the vagina. This is the reproductive tract. Inside, you have to give incision in between, and you have to follow. Then the ovary has three ligaments: mesosalpinx, mesovarian, and mesometrium. Mesometrium is uterine ligament, so you have to deal with all ligaments. There is no blood supply in these ligaments. You just tear it, pull it, and it's torn. You have to take care of the blood supply and the pedicle. So in this picture, you can see the suspensory ligament which is broken. Just to in the green circle, you can see suspensory ligament. It is broken. You pull it with the help of your grab the ovary in your hand and you pull it, and you can feel the suspensory ligament, and you break it with your index finger and the ovarian pedicle, which has the blood supply, which is most important thing. And then you have to ligate this pedicle, and then you remove break the ligaments on the ligaments and to just pull it out. These pictures also show how you have to handle with the uterine horn and uterine pedicle, and you have to how you have to ligate the ovarian artery. And so next surgery is castration, most commonly performed neutering. It's called as to desex the animal to remove the reproductive organ. Testes, they produce testosterone, which is responsible for male sexual behavior, for the temperament, and for dogs making problem. They urinate, they fight. So animal is calmed down after castration. So prevent the breeding through the dog population management to control the behavior. Sometimes there is tumors in the testes, interstitial cell tumor, Leydig cell tumors, and they are very common in dogs at older age or even in the younger age. So in case of trauma, in case of some, we have to remove testicles and if their prostates are enlarged, we have to remove because testosterone has also effect on the prostate gland. In case of perineal hernia, we also remove the testicles and to make the animal docile. These are the indications. And this is the testicular anatomy. Main testes, it is covered by epididymis, uh, not covered by its albuginea, tunica vaginalis, parietal layer, which is a wide extension of the peritoneum, which covers the testes from the outside. And there's epididymis, head, body, and tail, which is a storage for these sperms. And test sperms are produced in the testis, storage to the epididymis. Then there is spermatic cord of vas deferens. Okay, all these are called as spermatic cord. And there is a cremaster muscle, which is also a muscle which is there. And also there is pampiniform plexus. Pampiniform plexus is a venous plexus which is has a role in thermoregulation. It cools down the temperature. It keeps the testes at a lower temperature than body temperature for spermatogenesis. Then all these structures are there. So what you do that you give incision, prepare the animal, shave the scrotum, everything, and scrub it, and then you use drapes, and then you give incision on the. There are three techniques basically for castration. I will explain only pre-scrotal approach, and third is scrotal ablation. In the pre-scrotal approach, you push the testicle on the area just cranial to the scrotum under the skin, and you give incision there. In the scrotal approach, you give incision on the scrotum, and in the scrotal ablation, you remove all the scrotum and the testes also. So we in pre-scrotal approach, we give incision, just take the testicle out through that incision, cut the tunica vaginalis, testis is out, then you ligate the blood vessels and do perform three clamp technique here. And through three clamps, you can put ligations, and then you check the stump for bleeding and put the stump back. Remove the second testicle through the same incision. You push the second testicle with the help of your fingers under the skin, advance it under the skin in the prescrotal area, and you give the incision and take the second testicle through the same incision. Castration in case of cats, we do the scrotal approach. We give two incisions on the testicles, and we remove through the same technique. And in cats, it's a sutureless technique to ligate the blood vessels along with the muscles and non-vascular part or the vas deferens, the spermatic cord. Sorry, the yes, the spermatic cord and the blood vessels. You knot them 3 to 4 knots. You apply them and cut and to
and the cat heals very good results, very good, very properly. So in horses, we use open approach. Also, testicular incisions are given, and they are not sutured, because if you suture, there is no drainage, and if there is no drainage, there is serum accumulation, because abdominal fluids are coming out, and drainage is also good for healing, and it does not sports infection. If there is you apply suture, there could be infection. So there can be many complications after, like pain after swelling, and infection can be there. There can be dehiscence of the suture. If the sutures applied on the blood vessel, they are open, there can be bleeding. Or, but the next surgery is most commonly performed is cesarean section. Caesarean section is indicated in case of some anatomical abnormalities. Animal is not able to give birth. Vagina is very small, or it's not the birth canal is not so open, so wide. There can be some bone, can be short or narrow. uh, Sometimes there is a rupture of the uterus. The fetus is out of the uterus. Some uterine torsion can be there, which can result into. Sometimes people give oxytocin injections, which induces contractions, but the passage is small, and the uterus is ruptured, and it is inside the abdomen. So in that case, you have to perform C-section. Cesarean is also indicated if there's animal is small in size, and the male animal which was used for breeding, it's small. The fetus is very healthy and large. It is not delivered, and sometimes there are multiple fetus, 6 to 8 fetus, and the first fetus is dead during delivery. It is stuck in the abdomen birth canal, and the rest fetus are also suffering, and they are not able to be delivered. So in that case, also we use this cesarean section. So uterine inertia is also a cause. Sometimes uterus muscles they don't contract and put the fetus out. So in this case, fetus animal is prepared properly. Dorsal recumbency, ventral midline laparotomy. Incision is a little bigger. Linea alba exteriorize the gravid uterus. We have to put your hand and take out the uterus one by one, and all the uterus is exteriorized and on the drapes. And then a stab incision is made on the ventral part aspect of the uterine body. Uterine body, you give a incision, and you remove the fetus from that incision, milk out the puppies one by one. Hysterotomy. It is called as hysterotomy. Incision is given on the uterus. Then you, after removing all the uterus, you remove also the placentas, and you suture the uterus in 2 layers. Inverting sutures are conal, and pushing sutures are applied in 2 layers. And closure of the mucosa, inverting pattern, ceromuscular layer is involved, and close the uterine incision. Then the abdominal wall is sutured in the same pattern, muscles, then separate sutures, then skin sutures, rectus, teeth, and subcutaneous tissues, and then the skin. So this is the picture showing how you give incision on the ventral side of the body of the uterus, and then how you take out the fetus, and then you have to clamp the umbilicus of the uterus, because there can be bleeding. The fetus is given to the assistant. They take care of the live fetuses, and then the uterine incision is closed. Then anastomosis is means a surgical procedure that connects two sections of the intestines once a diseased portion has been removed. After removing the diseased portion, the rest two portions are to be aligned, or they are sutured together. And there it is done in case of devitalization or necrosis of a certain part of the intestines. Irreversible, irresolvable obstruction. There is some foreign body or obstruction there. You have to remove this, and the part is devitalized, necrosed. Then there is segmental dysfunction. Sometimes a certain segment of the intestine they are not functioning. There is chronic constipation, and there is not intestinal movements are not there. Then you have to remove that. or perforation of intestines. If there is, then it is not repairable, then you have to remove that sixth part. So this is the mesenteric blood supply and the intestines, and you cut a specific part of that intestine, and then you suture the. In the third picture, you can see they have sutured the rest two segments together with the help of Vicryl absorbable suture material. You take all the three layers, and simple interrupted sutures are applied very closely. There should be no gap between those, so that there is no leaking. And the mesenteric blood vessels, they are ligated, and then they are. It's a very common procedure. So sutures and stapling techniques are also available now. Latest Johnson's company, they are making staples, different companies. So these two portions are stapled together with the help of special staples. Anastomotic devices have also been developed. So in case of we use taper needles, monofilament sutures, and appositional sutures are used in case of intestinal anastomosis. Staples are also very common, but they are very expensive. But like in case of surgery, nothing is expensive. You can use staples if they are available for the correct size. So laparoscopy is also being used to do these things. Laparoscopic, you can put camera in the abdomen, inflate the abdomen, and you can use special laparoscopic instruments. And laparoscopic assisted anastomosis or laparoscopic, this can also be done. This technique is for single layer continuous end-to-end intestinal anastomosis. So all these things are being done in case of to avoid the laparotomy in CNs, and laparoscopy is a very latest technique and very being practiced very successfully. Cystotomy. Cystotomy is the incision on the urinary bladder, common surgery in case of small animal. There is a lot of uroliths, stones in the urinary bladder, which are not easy to be removed. And stones are there is no medical solution, then you have to perform laparotomy, open the bladder, cut the bladder, and stones are removed. So, general anesthesia is always needed in all these kinds of mm, surgeries. So, caudal midline laparotomy you perform, and to bring out the uterus, to give incision on the dorsal side of the uterus, because if you give incision on the ventral side, there are chances of leaking. So, on the dorsal side, you give incision, you remove the stones. All the cystotomy stones are removed. The bladder is flushed with normal saline, and then you close the cystotomy incision. So this is a bladder incision. Then it's the third picture. You can see how you suture. It is also sutured. All the hollow organs, they are sutured in two layers. An inverting suture pattern is used, conal and Cushing, so that the layers are inside, and it also heals up very efficiently. There is also a procedure called colopexy, in which colon is fixed with the abdominal wall and sutured there. Colopexy is indicated in cause of chronic rectal prolapse. Sometimes rectum is always comes out of the anus, so you have to push the rectum back through laparotomy. You have to suture the colon with the abdominal wall. In case of perineal hernia, we also perform colopexy. So surgical technique, ventral midline incision or paramedian incorporating incision. Laparoscopic colopexy can also be done, but in otherwise you just put the uh, through laparotomy you can, and you can fix the uh, colon with the abdominal wall. So all these are the soft tissue surgeries. Now I will discuss just not in detail, but I'll just enumerate orthopedic surgeries which we commonly perform. Orthopedic surgeries are ruptured anterior cruciate ligament. It is at the stifle joint where there's patella. There's are the four ligaments, anterior, posterior, or ligament, cruciate ligament, median or lateral. Once a cruciate ligament is broken, there is patellar displacement and there is chronic lameness. And in case of hip dysplasia, we perform femoral osteotomy. Femoral head is cut and it's taken out of the body. For hip dysplasia, it's a good treatment. Triple pelvic osteotomy. Pelvis is cut, the bone is cut. For case of hip dysplasia, this is also treatment, and his hip displacement surgery is also done. So it means that once hips are totally out of the socket, they are fixed back into the socket, acetabular fossa. So this surgery is also performed in orthopedics. Leg amputation is common. Sometimes there is paralysis or the leg is totally damaged. We have to perform leg amputation, hand amputations, finger amputations. Sometimes you have to perform bone fracture repair like femur, radius ulna, tibia fibula, femur, humerus. They are broken. You have to perform intramedullary pinning or plating or wiring, or there are different kinds of nails. You have to correct this by intramedullary pinning or plating. So arthroscopy is also very common nowadays in case of orthopedic procedures. Medial patellar luxation, anterior patellar luxation. For this, you can use the luxation. You can correct with the help of suturing and bringing back the patella at the right position. But for orthopedic, you need special instruments. They are not normal instruments. Like Jacob Chuck, you put the pin. It's a pin holder to push the pin inside the medullary cavity of the bone. You need the pin cutter. You need the hammer to push the pin inside. You need chisel. You need stainless steel wires. You need orthopedic different. There are orthopedic surgical sets different. So we will discuss orthopedic surgery in some other session. So very thank you for your attention, and I have tried to pull up very large topics in as short as I could, and I hope I am able to make you understand some basic things. So any questions for today's session, please you can ask.
सर उसका क्वेश्चन ये है कि वो कह रहे हैं कि जब सी सेक्शन परफॉर्म करते हैं तो सी
हाँ,
सेक्शन के साथ जो है ओवीएच भी परफॉर्म कर देनी चाहिए या नहीं?
इट डिपेंड्स इफ द बिच इज यंग और उसका पोटेंशियल है ब्रीड करने का, तो फिर उसको
सर सी
आपने
सेक्शन अकेला परफॉर्म करना चाहिए या साथ में
यूट्रस को
ओवीएच भी
रिमूव नहीं
करनी
करना।
चाहिए?
लेकिन इन सर्टेन केसेस एनिमल इज ओल्ड इनफ, वो उसकी और एक्सपेक्ट नहीं कर रहे होते कि इसकी हमने और बच्चे लेने हैं, तो ओनर्स खुद रिक्वेस्ट करते हैं, और यू हैव टू टेक अ कंसेंट फ्रॉम द ओनर। सम पीपल इवन रिक्वेस्ट यू कि जी आप इसका यूट्रस भी साथ ही रिमूव कर दें, क्योंकि वो ओवीएच या उसकी भी उनको जरूरत नहीं पड़ती, पैसे बच जाते हैं, एक ही सर्जरी में दो काम हो जाते हैं। लेकिन इफ द एनिमल इज यंग, you have given incision on the body of uterus which heals up, or animal can become pregnant again, he can breed, he can produce. But if the owner requests you, or you can take a consent, he does not wants any future breeding, because OVH is a reverse irreversible process, उसके बाद दोबारा एनिमल कभी भी ब्रीड नहीं करेगा फॉर लाइफ। तो इन दैट केस आप यूट्रस अंदर रहने दें, और अगर रिमूव करवाना है उसने तो करवा दें। बाज का यूट्रस में ट्यूमर्स होते हैं, यूट्रस इतना बुरी हालत में होता है कि यू एडवाइज द ओनर के इट शुड बी रिमूव। तो इट इज बोथ थिंग्स कैन बी
सर
डन।
सी सेक्शन के बाद नॉर्मल डिलीवरी पॉसिबल है?
बिल्कुल पॉसिबल है, और दो दो तीन तीन चार चार लेटर्स भी लोगों ने उसके बाद सी सेक्शन के बाद नॉर्मल हेल्दी लिए हैं, लेते हैं। इट डिपेंड्स कि हाउ गुड सर्जन इज, कितना अच्छी सुचरिंग हुई है, क्योंकि अगर कोई ब्लडर हुआ है तो फिर तो मुश्किल हो जाता है, लेकिन अगर सर्जरी अच्छी हुई है, हीलिंग अच्छी हो गई है टाइम पे, तो इट इज वेरी गुड। इसमें हम प्रॉब्लम कॉम्प्लिकेशन होती है, हेमरॉइड्स बन जाते हैं, या यूट्रस इंसिजन जो है वो कहीं और बॉडी के साथ हील हो जाता है, अंदर से अटैचमेंट्स बन जाती है नॉर्मल। तो इन दैट केस जो है वो आपको करना पड़ता है दोबारा से, फिर मुश्किल हो जाती है ब्रीडिंग, लेकिन पॉसिबल है। और कोई क्वेश्चन?
सर अगर हम कोई भी सर्जरी परफॉर्म करते हैं
हाँ,
तो उसके बाद जो पोस्ट ऑप केयर होती है उसमें सर ये कौन कौन से एंटीबायोटिक्स यूज कर सकते हैं, लाइक इनका अच्छा रिजल्ट है?
हम लोग वी शुड प्रेफरेबली हम फर्स्ट जनरेशन एंटीबायोटिक सेफ्लोस्पोरिन्स हैं, सेफ्राडीन है, वेलोसेफ है, इसका बड़ा अच्छा रिजल्ट है. यू शुड कैन आल्सो गो फॉर ऑक्सीडिल, यू कैन गो फॉर क्लेफ्रॉन, यू कैन गो फॉर इवन कोई भी आप अच्छी थर्ड जनरेशन एंटीबायोटिक्स पे भी जा सकते हैं, लेकिन प्रेफरेबली यू शुड रिमेन इन दी फर्स्ट जनरेशन. या पेंसिलिन्स का भी बहुत अच्छा रिजल्ट है, ब्रॉड स्पेक्ट्रम भी है. और यू कैन यूज एमपी क्लॉक्स, इवन यू कैन यूज ऑगमेंटिन का बहुत अच्छा रिजल्ट है हीलिंग में आफ्टर सर्जरी. ओरल भी और इंजेक्टेबल भी, इन्फ्यूजन्स भी अवेलेबल हैं. सिप्रोफ्लॉक्सासिन का अच्छा रिजल्ट है. सो एनी गुड ब्रॉड स्पेक्ट्रम एंटीबायोटिक. बट इफ योर सर्जरी इज एसेप्टिक, आपकी एसेप्टिक टेक्निक्स अच्छी हैं, तो आपकी एंटीबायोटिक्स पे आप कम डिपेंड करते हैं.
ओके सर, ऑल राइट.